A despondent young doctor, Dr. Excellent Nkona graduated in 2021. The 30-year-old has been unemployed since completing his community service in 2024.
It is quite a difficult phase for anyone to go through, really. Also, because you wake up, you don't know what to do, start overthinking. You don't even know if, have you chosen the right career or what, are you going to eventually get employed or this is it, well. So it's quite difficult. And also the fact that it also starts to affect your mental health as well, And you also become very hopeless because there are more people who have been unemployed for longer periods than myself.
Dr. Nkona is not alone. Zanele Fakude is a trained pharmacist. She also can't find work.
Completed my undergrad degree, did my internship, then community service, and I thought by now I would have secured some form of permanent employment or a job, and I haven't. So I'm even considering going back to school at this. It really is demotivating because when you go to school, you're thinking that I'm going to come back and I'm going to be helping my community, I'm going to be contributing to healthcare, and that's just not how it's happening, It's like a waste of time and money.
Hundreds of doctors and pharmacists share the same reality, despite numerous marches where they demanded that the government unfreeze posts in the sector. Unions say the problem is worsening year after year.
At this moment in time, we just have a similar situation to that of the previous year, where we have a new cohort of over 1,000 pharmacists that have just completed the requirements to register as a pharmacist, that are currently looking for employment and they do not have anywhere to turn to. We just have an element that has worsened the situation, where we have recent graduates of the pharmacy profession that have just stepped into the field and they have no prospects and way to complete their internship, which is the statutory requirement for them to register as practitioners. The government this year has taken in less interns than they have in previous years. So we are definitely alarmed by that, and we are calling on the president as we are nearing the State of the Nation address to just focus on the allied health as well, because it seems as though the allocation in terms of the budget, we have no focus on the allied health.
We worked on countless marches nationwide that have sought to find a remedy to the problems that we have raised as a trade union, amongst which the unemployment of doctors, the limited number of spaces for registrarship training wherein doctors would now be trying to specialize into the different fields, the dilapidated infrastructure, and in the province specifically, we've complained about the lack of a mental health institution and the fact that we are the only province currently that does not have a medical university. Whilst we still have complaints about the issue of unemployment of doctors, we need to hope that in the State of the Nation address by the Honorable President, there is going to be an address of all of these issues that we have raised. And
an analyst warned the impact could be long-term and that young people may lose interest in medicine.
This is a critical skill in rural areas. People have to travel long distances because clinics are not working, doctors are not there. You have to wait for a doctor for quite some time. So it discourages. Yes, it is a critical sector, but it seems to be neglected partly by the government as well as those that are in the health sector because of the limited funding as well as limited budget that they offer to that sector. The president, together with the the Minister of Finance, I think there needs to be something that needs to be done within them in terms of discussing what is the way forward in terms of increasing the budget to ensure that more and more people are absorbed, and also work with the private sector, private hospitals, private clinics and all of that, to work with them in order to ensure that more and more people are also absorbed. Subsidizing them could be one of the ways.
Unemployed doctors and pharmacists and healthcare system that's under pressure, all eyes are now on the president.